Well, gender transitioning for children has divided medical boards and communities across the globe this year, with the tide starting to turn against what is referred to as gender-affirming care. The NHS-run Tavistock Clinic in the UK is set to close next year, and here in Australia, the Queensland Children's Hospital's gender clinic has this month been put under official review after extreme concerns by senior health officials over their treatment approaches. Now, you probably haven't heard this anywhere else because the only person who's reported that this review is underway is independent journalist Bernard Lane. I recommend you look up his work. Now, when this idea of a review was first suggested by doctors in June, the hospital denied there was any need to look into things. And earlier this year, senior child and adolescent psychiatrist Dr Jillian Spencer was asked to leave her role at the hospital for expressing concerns about the gender affirmation model the hospital had adopted, and now she's worried about what the government's review will actually achieve. Well, joining us now is Dr Jillian Spencer. Jillian, welcome. You were, of course, as I said before, asked to leave your role at the hospital. You expressed concern about how things were going. Just tell us what happened there.
Sure, yeah. Well, my situation has turned into a little bit of a saga, but just briefly, last year I started raising concerns about the use of the affirmation model by the Queensland Children's Hospital because I became aware of the lack of evidence underpinning the model and also the serious harm to children from the affirmation pathway, which is social transition, puberty blockers, cross-sex hormones and gender surgeries. My concerns weren't well received by the hospital executive, and then suddenly in mid-April of this year, despite having worked for Queensland Health for 20 years with an unblemished professional record, I was suddenly removed from clinical duties on the basis of a single complaint of transphobia from a troubled adolescent. And then last month, my situation changed again because I was formally suspended by the hospital, and they've alleged that I've breached the code of conduct over 20 times by speaking publicly about my concerns regarding the harms to children from the affirmation model. So I've heard it loud and clear from the hospital that they don't want me speaking out about my concerns, but it's a real ethical dilemma because I know there aren't many psychiatrists who are willing to speak out, especially after they've seen what's happened to me. And my obligation to my employer to keep the harm to children secret clashes with my obligation and responsibility as a psychiatrist and as a human being to speak out when the care being delivered to children isn't safe and isn't evidence-based.
Well, it would seem as though you have essentially been pushed out. Now, obviously there is some concern elsewhere because this review has now been commissioned. The hospital said earlier in the year that it didn't think there needed to be a review. How did this review come about?
I'm not sure how it came about. It's only just been announced, but unfortunately, it looks like the clinic is just going to be reviewed to see if it's meeting the recommendations of a document that was written by hardline gender activist clinicians and first published back in 2018. And the activist clinicians titled their document, "The Australian Standards of Care for Trans and Gender Diverse Children." And the use of Australian standards in the title is a trick to artificially inflate the reliability and reputation of the document, because actually the document has never been officially endorsed apart from by the transgender activist clinician organisation AusPath. And the recommendations in the document aren't underpinned by a systematic review of the research literature. The authors of the document acknowledge that the recommendations are based on the consensus view of a group of AusPath clinicians and underpinned by the position statements of WPATH. So the document is very affirming of children, and it encourages the family and everyone around the child to take an affirming approach. It even recommends that the clinician liaise with the child's kindergarten to promote the child's social transition. God. It views the kids attending gender clinics as naturally trans and any mental health problems that they're suffering as primarily being due to the stigma of being trans. And the only treatment pathway it talks about is, surprise, surprise, social transition, puberty blockers, cross-sex hormones and gender surgery. So I do fear that the Queensland Children's Hospital Gender Clinic is going to pass this review with flying colours. And if that's the case, it's going to be the children and parents of Queensland that lose out.
Well, as you say, I mean, these very guidelines that the hospital will be measured against claim that puberty blockers and cross-sex hormone treatment, surgeries, etc. are life-saving. So, they're basically setting it up to say, OK, well, we've ticked the box, all is good here. But when you look at the way things have gone around the world, as I said before, Tavistock is closing down and it's not the only one. It does feel like the tide is starting to turn a bit. When is that going to reach Australia?
Oh, I really wish that Australians would start getting a bit louder in telling their politicians that they're concerned about the harm to children from the affirmation model. And I just don't think parents realise the extent of the problem, and they don't realise how distressed and powerless they are going to feel if their child develops gender dysphoria. And no matter where they turn, they can only access gender-affirming care.
In terms of this international change, and as I was saying before, the fact that it hasn't happened in Australia, what's driven the change internationally as opposed to not in Australia?
Yeah, it's different for different countries. So, say, for example, in Sweden, there was a media program, the Trans Train, and a lot of very concerned parents of teenagers with the onset of gender dysphoria during the adolescent years that really pushed for change. And then in our other jurisdictions, it's been more of a political response. So it can come from the people or it can come from the government. And actually, in Finland, it came from the doctors. So I wish that would happen, but the doctors in Australia are too scared to speak up. But in Finland, it was the gender clinic doctors that said that they were concerned and asked the government for guidelines.
Well, as a doctor, I think it is your job and your priority to speak up, and thank you for doing so. Dr Jillian Spencer, Merry Christmas and thank you for your time.
Thank you.